Mexican doctors are currently using stem cells to treat ill foreigners, including Americans who suffer from ailments such as autism, paralysis, cerebral palsy, and it has been the country's been highly critiqued for that as well.
You said criticized for
the lack of regulation.
Okay, so have there been injuries or harm come to people who have gone there for stem cell therapy?
Yes. Many people come back with new blood diseases because it's not as clean as the United States is, the hospital.
Okay, so that's a sanitary issue.
Yeah,
that's
it's
an
just
issue
sanitary
separate
issues.
from
and then
the
also
stem cell.
people have reported tumors as well.
Okay.
South Africa enacted legislation that banned reproductive cloning but authorized therapeutic cloning, and they were the first nation to create a stem cell.
So if you were to undergo stem cell therapy, do they actually take stem cells and inject them into you, or is the hope that with the testing on the stem cell it's creating a new medicine?
The goal of stem cell research is to create new gene therapies and medicine. So they're not usually putting stem cells into you. They're just trying to create medicine that can help whatever disease you're suffering from or cancer.
So it's a research tool, not a therapy in itself.
Yes.
Okay.
So what has been successful? What is something you said is, you've mentioned successes, but what's something that has been from the research now, maybe even now, a regular practice because of stem cell research?
Well, I've researched a little bit about PCOS, which is polycystic ovarian syndrome.
Okay.
And it's super random, but I was actually diagnosed with that on Tuesday. So I thought it would be interesting to see. So they have done a lot of research with PCOS in rats and mice. And there have been successful gene therapies that can help mice who have PCOS, and they can help them overcome some of the symptoms, I guess, because there's no cure for PCOS. But none of those, they don't know if they'll work on humans. So they're trying to use embryonic stem cells to test out the gene therapies for the mice and the rats on our stem cells to see if a gene variation of that medicine can be used for people like me, I guess. So there aren't a lot of drugs, I don't think, that they've come up with that have worked.
Also, though, there has been with blood-forming stem cells in bone marrow are currently the only type of stem cell commonly used to treat human diseases. They've been doing this for over 40 years now. The clinical potential of somatic stem cells have also been demonstrated in the treatment of other human diseases that include diabetes and advanced kidney cancer. But however, these newer uses involved very limited patients, so it has helped cure a lot of people with certain diabetes. There has been I don't recall the number, but a group of people they tested that were cured due to the treatment from the blood forming stem cell marrow.
Are they using it to produce insulin? Did you remember across that? 'Cause I know they use pancreatic stem cells and reproduce, but are they producing insulin from that? Anybody run across that research?
I don't know.
Okay.
But the research that you just described, the one that's been going on for 30, again, those are not embryonic stem cells involved in that. So that's something that that's come about.
They've been doing it for 40 years now too. So.
Okay. And so have you found any controversy or any concerns with people using stem cells other than embryonic stem cell? I mean, is the sort of the whole practice of stem cell research controversial apart from the destruction of the embryo issue? If that wasn't a part of it, does anybody else have an issue with stem cell research?
Other than using an embryo,
right.
I do not have a problem with stem cell research. Some Christians would say that, this is something I agree to, that humans are uniquely and they're made in God's image, and that He makes everyone specific and certain way, and so why would you try and like do certain things to that? I think that's almost an extreme, and God creates, you know, science and technology for good reasons too as well, but I do not believe that
Okay.
stem cell research is.
Okay, so so that argument that you suggested is one that would apply to any kind of research into, you know, helping,
Changing
you know, genetic diseases or, you know, any other kind of disease. It's people who sort of assume this is the way God made you, just live with that.
Yes.
Okay.
You mentioned earlier that cloning has been banned, like you can't use the stem cell research for that. When you say that, are you talking cloning an entire person, or are they looking into like taking pancreatic stem cells and growing a new pancreas? So now we don't have to like donate our liver or something, like we can grow one for other people.
Yeah.
Is that an end game?
Well, I know there's two different kinds of cloning. There's the fertilization cloning, which does create a new like human being, and then there's therapeutic cloning, which is what you were describing with growing new like your own body parts, so that they can take my stem cells and like create an embryo clone of me, I guess, and grow my own like things like a liver that would match my liver. So if I ever need
So would they have to actually make an embryo, or could they
Yes.
just clone the organ?
no, they would have to make it.
So are there any restrictions that you have found on scientists creating an embryo just to get to those embryonic stem cells?
Yeah, that's not allowed.
Okay, so you did find some regulations against that.
Yeah.
Okay, so you're all ladies, all forced, or not forced, but faced is what I'm going to say, one day with the idea of having children. If you were happen to, and I hope this is not the case for any of you because it's miserable, go through infertility, and you were into this in vitro process, okay? And then, so you find yourself with 2 or 3 children at this point, but you know that you've got a whole bank of embryos somewhere that are being frozen. What do you do with them?
One solution to that would be embryonic adoption.
Okay?
In 1997, the Nightlight Christian Adoptions pioneered this embryonic adoption program called the Snowflakes Embryo Adoption Program. And through that, over almost 500 babies have been born to their adoptive parents. So that's definitely a good alternative
Okay.
than to just let them sit there forever. But of course, that's not going to save all of them.
Yeah.
So
So there's probably thousands, I know there's thousands,
millions.
maybe, yeah, hundreds of thousands at this point. What do we do with them? Because this is kind of part of this process, you know, I mean, because there's a process now in place that they could be used, but they're not being used. Ashley, what do we do with them?
I mean, you never know how.
Well, let me rephrase. What do you do with them? If this is you and you're in this situation, what do you do?
I mean, it's impossible to judge how technology will advance from here until then, and it's possible that they could find a way to research embryonic stem cells without destroying the stem cells themselves. If that were the case, that'd be a good use of it,
Sure.
because there are benefits of the stem cell research. But as far as for me, I wouldn't donate them for that use now currently, because it's destroying.
But if you got, a couple that says, yeah, this can help somebody else.
That's
Use
kind
it.
of the view that I take. I have had multiple family members die from Alzheimer's, and
Okay.
they're talking about treatments and cures based on stem cell research. And I know, like, the flip side of how horrible it is to watch someone's brain deteriorate in front of you. And then, like, with my PCOS, I guess that's the #1 cause of infertility in women. So I'm like,
You're nervous.
yeah. So I would be okay with donating.
Is there a shelf life, for lack of a better word, for them? Like, if they're just sitting there, like, does
Freezer
there?
life.
Yeah,
Freezer
yeah.
life.
Does there become a point where they're no longer useful for anything? So in that case, would be like just disregarding that it was a life?
That's funny because I asked the same thing when we were talking about this. I was like, do they expire? But it has not been proven yet that they expire. They can stay like frozen for however long, but there's still no guarantee that they can
That they would
work
grow.
well.
Yeah.
Like even in the beginning of the processes, they could be damaged or so there's no answer.
Which is why they make so many to begin with, right? Yeah.
This is sort of a, I don't know, odd question, but so do all of you believe that so an embryo represents life? And I mean, it's okay if you don't. I just was okay. So is there a concern with doing experiments on very, very small life? I mean, we don't really allow human experiments on full-blown adults unless you've met a lot of FDA regulations. But you have to go through animal testing, and testing's in the lab. You have to set before we're going to test you on a human. In fact, I mean, during Nazi Germany, Dr. Mengele got in all kinds, for experimenting on Jews. That was torture. I mean, do we have some concerns about whether we should be doing experiments on a life, albeit very, very small life?
I think it could. It has the potential to spiral out of control. I think.
Especially with advancements in technology, I think that can get abused very easily.
The only issue with that is that then what do you do with them next? Just throw them all away?
I mean, yeah.
Yeah, like that's the only thing with that.
And I guess that's something for those who are going to engage in that form of creating these embryos to maybe make a decision about that or think about what to do with that afterwards. I don't know. It's interesting how the two issues are linked. You were focusing on the medical aspects and the things that we can do with stem cell research, especially embryonic stem cell research, and it seems like this would be a great way to test our drugs, but you have those morals and ethical restraints on that. When a child dies, a parent can offer to donate or be willing on the child's behalf to donate, body parts, eyes, or whatever. I mean, can a parent really donate an entire life?
It's such a tough situation. I'm so like torn between what I believe morally and ethically, and then the benefits. So I don't know.
Well, and that's where your ethics and morals prove themselves. I mean,
Right.
we can always be, hypothetical and think, in a perfect world, but then when you're really sick and you really need treatment, how far are you willing to bend or push your ethics to get there? Do you find that the United States is on par or behind the rest of the world when it comes to this issue?
I think the U.S. has more restrictions than most.
We're less progressive than a lot of European countries. We're like 10 years behind. If you think about it, I've gotten the opportunity to travel like a ridiculous amount across Europe, and just social issues that we're fighting for here, that a lot of people are fighting for here, have been legal over there for now 10 years. So 20 years. So I'd say we're way more conservative than Europe and some parts of Asia as well.
Are we worse off for that?
Pardon?
Are we worse off for that? I mean, are they better? Do they have a better quality of life, better health care, better options over there because they're willing to push these envelopes, and we are, to lack of a better word, suffering or doing without here because we're holding a moral line?
I think it kind of comes from our whole, the fact that the United States is comprised of a lot of Christians, and they kind of value the morals higher than other countries might if they weren't based on that Christianity and that moral code. And so we take that into every decision we make rather than it just is kind of something that's in the back of our mind.
Yeah, and I guess my question is, are we hurting because of that? I mean, is it to our detriment? Can you tell?
It's an opinion question.
No,
Okay.
I'm doing
Thank
all
you.
right.
Okay. Well, I mean, we talked about the time period when President Bush put a limit on the use of stem cell research. Did we fall behind the rest of the world during that time period? I mean, have we made great advances in the time since Obama has opened it up and permitted it? I mean, I'm wondering, is there a difference?
I mean, like as Kirby said, we're already behind anyways, and I don't think that it's detrimental to, you know what I'm saying? Just
I do understand what you're saying, and it's just something to think about, because those who are frustrated with policies in the United States that they seem antiquated or, you know, too restrictive, and the question is, what are you really missing out on? I mean, are you really going to, is there all of a sudden this explosion of technology and discoveries and new therapies and new treatments that's going on in places where they have free reign with stem cell research as opposed to what's going on here? And I'm asking, in your research, have you found that we're hurt or we're falling behind in a way that's, you know, harmful to patients here in the United States?
I don't think so, because they haven't found cures for Parkinson's or Alzheimer's in other countries, and neither have we. So we're still just looking, I guess, for cures, and nobody's found any, even though we're 10 years behind. So I don't think it's made a huge difference.
And I mean, even if they did find a cure, I feel like it'd probably be like on Google or something, and America could look it up and then just copy whatever they did.
Well, we probably have to destroy some some
Right,
embryos
exactly.
to do
And so
that.
then we make
are
new
we willing?
laws and new regulations.
Okay, yeah. And I guess then the argument becomes, if we're not missing out, why should we change our restrictions? Why should we violate our own sort of moral code to just for a possibility?
I think people are so desperate to find a cure and have all the answers to life and say, you know, why is this disease here? Like, why can't we cure this or that? And so I think that's why there's such like a need to like test and figure out, you know, what's occurring in human bodies. And also, like, the United States likes to be number one and the best at everything. So I think that's part of like the need there too.
And economically, it would bring a lot of revenue if we were the ones who discovered the cures for some of these diseases. So there's that.
A lot of what Mrs. Euler was talking about, it's been 15 years since I was in the classroom, but we were talking about it back then, and it kind of comes down to just because we can, should we question. And so you really have to decide how far you can go with that. I mean, because there's a lot of things we can do. So don't have a question on that, but you can branch off of that if you want. But I asked this question the other day, and I'll ask it to you guys. What's the most interesting thing, if you haven't mentioned it already, what's the most interesting thing you ran across in your research? Something that either helped shape your opinion of this particular subject, or something that just really stuck out and said, oh, well, I didn't know that prior to looking into it?
For me, I'm not a biology student by any means. I have a real hard time like understanding like cells and like proteins.
You picked a good topic.
All that jazz, yeah. And so I was really interested to like learn more and become more educated in it. And something really fascinating I learned was about the cord blood and the blood within the placenta and the potential within the stem cells in there. I like when I think of like, you know, like giving birth and like what happens, like I thought you just like do away with the cord blood and the placenta, and like the fact that that can be used to benefit science. And
yeah, I did too. Before, like I said, before we got the questionnaire, I was like, oh, I never thought about that. So
yeah, I think that's really interesting.
The thing that I found most interesting was the embryonic adoption. I didn't
know you could do that.
I mean, that never really crossed my mind, but I thought that was really interesting.
For me, it was the PCOS stuff. I'm like such a science girl, and so I love reading medical journals. I don't know why, I'm so weird. But I spent like one night really late reading medical journals about PCOS and stem cell research, and I thought the opportunities were cool.
The first step towards fixing the problem is admitting that you have a problem.
Yep. Indeed.
Ashton, what about you?
For me, it was just all the possibilities that it brings about with like curing diseases and heart diseases and diabetes and that kind of thing. And with the embryonic controversy, I think it's kind of cool to just like look more towards the adult stem cell research and where that could take us.
Yeah. Researchers love this stuff for a reason. I mean, they're not just doing it because, I mean, they're looking for something. Do you have any idea how close they are on any of this? I know we kind of hit around that question, but Are they close to anything? Have they been able to